We are live now, doctor.
Yeah.
Okay,
Good evening, each and everyone. So we all know that Rajasthan Ophthalmological Society runs postgraduate and young ophthalmologist-centric sessions in the terms of webinars known as Kaksha series. So in that series today, we have Dr. Vinita Gupta. She is the one who's taking the masterclass. And her masterclass is on dreaming beyond borders, that is international exams. All young ophthalmologists should know how to prepare for the exams, how to give, and what to expect is what is going to be in this uh, Kaksha we have. And I welcome Dr. Vinita on behalf of the executive of ROS. Dr. Vinita is a professor and head of pediatric ophthalmology and division in AIMS Rishikesh. She is one of the few ophthalmologists who has done FRCO, FRCS, and MRC Ophtha, along with FICO. She's an examiner of FRCS and FRC Ophthal and FAICO. So she is a well-read and well-qualified ophthalmologist, and you may find her across the table in most of the exams. She is an advisor for the Royal College of Physicians and Surgeons at Glasgow. She's a course director and founder for Royal Eye Care course, which is a preparatory exam for FRC Ophtho and FRCS. She's editor for FRC Ophtho and FRC exams Part 2 exam companion, which has MCQs and OSCEs and Viva for FRCO and FRCS exams. And she has a extensive research portfolio, about 52 peer-reviewed publications, and a faculty member and a speaker for more than 250 national and international conferences. And she's also worked as a faculty and instructor for numerous courses on ophthalmology at various podiums for pediatric ophthalmology, biometry, IOL power calculation at national and international conferences. So today we have Dr. Ashu Agarwal. She's a professor at SMS Medical College, and she's an outstanding person and an outstanding surgeon. She's going to moderate this session. She's also an executive member of ROS. Along with her, she will have two residents who are going to be there on the hot seat. So over to you, Ashu, and over to you, Dr. Vinita, for this nice webinar we have. Thank you.
thank you, sir. So thank you, Dr. Akbar. Should I start my presentation?
Yes.
Okay. Yes, ma'am. So is the presentation visible? It's visible, ma'am. Okay. So as Dr. Akbar has mentioned, it's something like a dream which you have to go across the country. So if you are, whether we are in the residency stage, whether we are in the early, just out of our residency, just finish a residency, just gone to practice, or even thinking what to do next. And especially if you're looking at the international scenario, this talk will give you an overview of all the things which are available to you all across the world. My slides not moving. So this is, as Ankur has said, every young ophthalmologist who's looking for any migration or any other expansion of his own personal CV is he should know about all these exams. So why should we think about these international exams as a resident or as a young ophthalmologist? Because it gives you an international mobility. It opens up a lot of your fellowship opportunities abroad. And even if you do not want to move out, as if you're not thinking of migrating, it gives you a lot of networking as regards to academic and research collaborations, and also puts you on the forefront of a global eye care once you have this network developed. And obviously, in the end, or maybe I should say, as a part of the process, it leads to a tremendous professional and your personal growth. So you are looking at the entire world as your own campus for your education as well as for your profession. Why do these exams matter? They help you demonstrate your competence. They improve your CV, as I've already mentioned. You gain an international recognition. You can apply for fellowships all across the world. It enhances your own academic profile and it opens some migration pathways for people who are looking to migrate outside our own country. So the global ophthalmology landscape, if you look at, UK is the most favored country. Other countries in the Europe are less favored. Singapore is the next. Middle East, again, not for fellowship, but yeah, for job opportunities, a lot of people move there. And Australia and New Zealand. The US would be the last in this because of obviously certain reasons, because of the difficulty in and the time period which is required for the process. So the decision tree, whether which exam do you need to take, would depend on whether you are a resident, a consultant. What is your focus? Is it migration? Or is it only research and collaboration as your academic enhancement? So that is the way which will decide, or that is the point which will decide how will you choose which exam and which pathway. So let me talk about each and every exam, the different fellowship examinations, which will help you in taking this decision to choose which exam if you're planning to take up any of these opportunities. So this is a broad overview. You can have fellowships or move out to UK, US, Canada, Australia and New Zealand, Dubai or the Middle East, and Singapore. These are some of the website links which I've given for the common examinations, which are mostly centered in Europe and mostly of UK. Let's start focusing on the first part, which is the most accessible examination of all, which is the International Council of Ophthalmology examinations. Why take these exams? This is the international benchmark. It opens up avenues for fellowships almost all across 80 countries, which can be short-term fellowships and sometimes even long-term fellowships of 1 year. It enhances your CV. As I already mentioned, it is the most available exam, which can be taken in 80 countries across the world. And it is the most affordable also. So what is the pattern of these exams? It basically starts from a foundational exam and advances to clinical evaluation exam. All the exams are in the MCQ pattern. So there are 3 different patterns of examination. One is standard examinations, one are advanced examinations, and then there are also specialty examinations. So the standard examinations, the advantage of these standard examinations, once you clear them, is that it gives access to your FRCS Glasgow ophthalmic examinations, the final clinical part you can take without taking their first 2 steps. So this is the advantage of clearing your ICO standard examinations. So the first standard examination is the visual sciences, which is based on the basics of ophthalmology and part of epidemiology and statistics, which has 120 MCQs with a 3-hour duration of the exam. The second exam in this is the one which is targeting the optics, refraction, the various optical instruments which you use as an ophthalmologist. This has 60 MCQs, which is for a 1.5-year duration exam. The third exam in this is to be taken only once you've completed the first 2 exams. And this is the clinical exam. Again, although it is labeled as clinical exam, but again, it is totally an MCQ exam, but based on all clinical ophthalmology. And it has 200 MCQs of 4 hours duration. Then this is the next type of examination of ICU, which is the advanced examination. So standard examination is giving you access to take FRCS Glasgow examinations if you want to take them. But if you want a clinical tag of a FICO, which means Fellow of the International College of Ophthalmologists, then you will have to take this advanced examinations, where once we have passed this, there's a local face-to-face sort of an interview or assessment, after which you are given this degree of FICO. The advantage of taking this examination is once you take this examination, you have this tag along with your degrees. Then once you apply for any fellowships, whether it is short-term or long-term, it gives you extra added edge over the other candidates. It is not that you cannot apply without this FICO, but it gives you an extra edge when you're taking your interviews for these fellowships, especially in regions like United Kingdom, Europe, and Australia. And then we have the third type of examinations which are conducted by the ICU, which is the subspecialty examinations, which can be taken if you have a specialized 1 year at least experience in any subspecialty of ophthalmology. And these are basically checking your knowledge and your clinical experience and decision-making power in that subspecialty. However, they cannot be used as a assessment of your competence. So you cannot apply based on these as for international fellowships that you already have a fellowship with this. No, so that added advantage is not given with this for applications for jobs. So these are the first, some of the subspecialties which I've listed, which are subspecialty examinations which are being held by the ICO. The fellowships which are offered by ICO are both 3-month fellowships, which are across almost 80 countries. And then we have the association of ICO with World Glaucoma Association, which is again a 3-month fellowship at various glaucoma centers across the world. There is another association of ICO with National Eye Institute, where they're offering a 1-year fellowship in ocular genetics at National Eye Institute in US. And then there is an ICO FB Advanced Research Fellowships, which are again 1-year fellowships in subspecialties, which are open again across the world in different countries, UK to US to Malaysia to Singapore to all Australia, various places. Then let's come to the UK pathway, which, as I said, is the most followed pathway for people to migrate, actually, if they want to migrate. Here, the major qualification which is recognized if you have to migrate there is FRC Opt. Otherwise, you can also go for fellowship trainings. And if you do not want to do the complete FRC Opt pathway, you have something called as the portfolio pathway, which was earlier called as the CESR route, or the certification of the certification examination for the specialist registration route. And this FRC Opt examination is conducted by the Royal College of Ophthalmologists, London. So this is a big picture. If I say, either once you go in UK from a medical school, either you go and take the GP pathway, which is the general practitioner pathway, or you can get the specialist pathway, which is the ophthalmology specialist training pathway, which is almost a 7 years pathway if you have to take that pathway and migrate there. Or, as I said, there is another pathway, which is the portfolio pathway, which I mentioned. So I'll talk about both the pathways in detail. So FRC of examinations, they assess the quality, safety, and the efficacy of the ophthalmologist for treating as a general ophthalmologist. So they're not assessing your specialized skills. So it is a necessary part for completion of your training in UK, but not sufficient to start practicing there. So it has 4 parts. The part 1, which is totally a written part. Part 2 is not exactly in between the part 2 and part 1. There is something called as refraction certificate. Then there is part 2, which is divided into a written exam, and finally a oral exam. So there are actually 4 exams which you have to take at different intervals. They cannot be taken one after the other. So who can sit the exam for the part 1? You do not require any previous experience in ophthalmology. Anyone who is medically qualified can take the exam, which means for a medical graduate holding a medical qualification which is approved by the United Kingdom General Medical Council or the Irish Medical Council. In case this is not approved by any of these councils, your medical qualification from your college, you can attest, get it approved and attested while applying for your FRC Opt. Attestation may be done by any fellow of the college or by the Indian Embassy or a solicitor or by the university who has issued you the certificate. So that attestation can be done, and then also you can apply in case your college degree is not recognized by the UK GMC or the Irish Medical Council. So what is the structure of this exam? It is basically a totally theoretical paper, MCQ based, no clinical component. It is assessing your ophthalmology specialist curriculum, which is there in the first 2 years of ophthalmology training in UK. And you have to pass this exam if you're based in UK by the end of 2nd year. So it has a multiple choice paper. There are 2 papers of 2 hours each, and each paper having 90 questions. They are conducted on the same day with 1 hour lunch break in between. So it is basically covering all your basics and clinical sciences parts, basics of ophthalmology, the investigative modalities of ophthalmology, biostatistics, clinical genetics. All this is what is covered in this part, along with patient investigations, which we require as an ophthalmologist, which could be ophthalmic as well as non-ophthalmic investigations. So where do these exams take place? These are online exams. You need not go at any place. You can take them in the comfort of your home. But these are proctored examinations, having a physical online person who's proctoring and monitoring you. So how to book the exams? Obviously, there are these links which have given. For the first time applicants, you will have to log in and create a login. For a person who's already taken, it is very easy because you already have a login ID and your candidate number. So this is the sites which I have given, which are the links which I already provided in the previous slides. So you can just go to the college website and find the links to these. So how to book the exam, all the details are given there. The refraction certificate is the next part. So once you've cleared your part 1 written exam of FRCOPT, you go to the refraction exam. Now, this exam is assessing your ability to perform clinical refractions in a clinical setting. Earlier, it used to be only clinical exam with direct dealing with the patients, but now it is in a hybrid mode. It has both patients as well as simulators. And you have to clear this exam once you're part of the OST training in UK by 4th year end. Or by the 4th year beginning, sorry. And it is not mandatory that you take part 1 first, FRCOPT written exam first, and then do refraction. You can do either. You can take refraction first and then take part 1 FRCOPT written. So there is no specific order for taking these 2 exams. So who can sit this refraction exam? Again, as I said, no previous experience is required in ophthalmology. But if you have not done significant amount of refractions, actual clinical refractions, you will not be able to pass. So at least 50 to 100 clinical refractions, and especially following all those 10 steps of refraction, of subjective refraction, are required. Exemption is given only to people who have already registered with the Optometry Council of UK for the last 5 years. So what is the structure of this exam? It has 10 OSCE stations in 5 rooms. Retinoscopy is done on the simulators, on live patients, on each eye. Then you have subjective refraction on almost 3 to 4 patients, and subjective refraction is done in different parts. As I said, there are 10 steps of subjective refraction which are tested on different patients. There is a phosimetry and a phosimetry station. The keratometry station used to be there, but now it has been removed from the exam. At retinoscopy stations, which are the simulator stations, you just are supposed to record your findings. There's no examiner there. While at the subjective refraction stations, where the actual patients are there, an examiner is marking you based on how you're performing. He is not asking you any questions. So he's just observing your technique and marking. Each station is 10 minutes. Each hand has a marks of 15, making it a total of 150 marks. And pass marks are based on OSCE method. I will not go into details how this assessment is OSCE method is done. So what is the structure of these exams? As I said, candidates are required to pass all these OSCEs. If they fail, they have to resit the entire examination. And the maximum number of attempts allowed is 6 to clear the refraction. Then let's come to the part 2 exam. Part 2 exam, as I said, has 2 components, the written and the oral.
Vinita ma'am, Dr. Vinita.
Yes, yes.
Ma'am, can you clear few points in part 1 FRCO?
Yeah.
So, ma'am, you said that the refraction certificate can be taken after we clear part 1.
You can do it either
it can
way.
be taken.
You can do it either way, actually. It's not mandatory that you should have cleared part 1 and then you take the refraction. You can even take refraction as your first exam.
Okay, ma'am. So we can take it along with the clinical exam also after clearing
No. For clinical exams, once you reach the part 2, you have to clear the first 2 parts, which is the part 1 written and the refraction have to be cleared before you can apply for part 2 examinations.
And but if the candidate is having FICO UK, if they are having the post-nominal acronym of this, they've passed the examination, then also is this exam required?
Yeah. For FRCO of the examinations, FICO or any standard examinations taken by the ICO does not give you exemption. It gives you exemption only for Glasgow. FRC is Glasgow and FRC is Edinburgh also, actually.
Okay, ma'am. Thank you, ma'am.
For their first 2 parts. Third part, clinical part, is not exempted anywhere. And in this FRC of, initially it was giving some exemptions for their own MRC of candidates. But now since 2012, they have removed everything. Anybody who wants to now go and take these exams will have to start from the scratch. That is from the part 1 written, the refraction, and then only he becomes eligible to take the part 2 examinations. Okay.
Thanks.
So I'll continue after this. Any more questions?
Ma'am, please continue.
Okay. So the part 2 examination, as I said, has a written part and an oral part, which is the exit examination now. So this is the exit examination, which makes you eligible to get the completion CCT or the completion certificate of clinical training in ophthalmology in UK. After that, only you are eligible to apply to GMC for registration. So this part is mandatory to clear if you have to apply for GMC registration. It allows you, so once you clear this as an exit examination, you become a fellow of the Royal College of Ophthalmologists. And it uses different methods which are complementary to each other to assess the candidate. You are permitted a maximum of 4 attempts for your written exam and 4 attempts to pass your oral exam of the part 2. So 4 attempts for each. Who can sit the exam? As I said, only candidate who has passed the part 1 and the refraction. Not necessary to have passed the refraction, but if you have to get the completion certificate, you need to pass this refraction at the time when you're taking the written exam. For the clinical exam, the oral exam you're taking, you need to have passed both the part 1 FRCO of written exam and also cleared the refraction certificate exam. For taking the written exam of the part 2, you could have still not taken the refraction exam. So there is a sort of a confusion here. So what is happening? I'll clarify it again, because that's what the question what Tashu raised. So even when you have cleared your part 1 written exam, you can still go on without completing your refraction exam directly to the part 2 written exam. But once you have to take the part 2 oral exam, for that you will have to complete your refraction certificate also. So this is aimed at trainees in the 4th to 7th year of their training in UK. And it is basically assessing that you're suitable to practice independently. So pass this exam by the end of the 7th year of your training. And once you complete this, you get the award of Certificate of Completion of Training, or the CCT, as we call it in UK. And the validity of this exam, although there are 4 attempts allowed, but once you have cleared this exam, you will have to take within the next 7 calendar years your oral exam. Otherwise, you will have to, even if you have cleared the written exam and with the next 7 years, you do not complete your oral exam with your 4 attempts also, then you will be required to retake your written exam of part 2. Okay, so the 7-year period has been given as a grace period in which you will have to complete your oral exam also after your part 2 written exam. So what is the structure of the written exam? Again, it is a multiple choice question. Again, there are 2 questions of 90 questions, 2 papers of 90 questions each. All are MCQ based, single response answer types. Again, they are conducted on the same day with 1 hour lunch break. Again, this is an online proctored examination as a part 1 examinations. So you need not travel anywhere. You can take it at the comfort of your home. Pass marks again, in the UK, we use the Abel method. In this case, where it is basically a method where we are trying to use a combination of the ease of examination classified as easy, moderately easy, and difficult, and also the utility of the questions which are asked, as in importance of the relevance of those questions asked, whether it is relevant, whether it is essentially required to be known, whether it is something which is additional or good to know, and which is must to know. So this is a combination of all these factors by which we do this marking by Abel method. So part 2 of FRCO oral examination is the last examination, which is the oral, totally clinical examination. And once you complete this, you are eligible for the certification of completion of the degree, and you become a member of the Royal College. You become a fellow of the Royal College of Ophthalmologists. The purpose is to demonstrate, you should be able to demonstrate a depth of knowledge, understanding of an independent ophthalmologist who is a safe ophthalmologist who can independently treat patients. However, it does not require any subspecialist knowledge. The knowledge is required as a broad, vast knowledge in every subspecialty of ophthalmology, so that you know when to treat and when to refer the patient. Who can sit this exam? As I said, you should have passed your part 1, the refraction certificate, and the part 2 FRCO of written exam. Exam is again aimed at between 4 to 7 years, but by the end of 7 years, you will have to complete it. If you do not complete it, you're not eligible for the award of completion of your CCT training. Okay. Earlier it was held only in UK. I took my exams all in UK, even the part 1. But thereafter, for the last few years, and that's why they have started engaging more and more examiners. They have started conducting it in overseas centers, all the parts, including Singapore, India, Egypt, Greece, Malaysia, UAE, that is Dubai, and in Pakistan also. Pakistan is the latest center. This exam takes place in a mock clinical environment. It is the same standard as for the UK exams, and the performance and the expectation are the same, although the marking pattern is slightly different. How is the exam marked? So in the UK, we use is the borderline candidate method, but for the overseas examinations, we started using the Hopsy method, because what is happening here, we have a smaller cohort of candidates. We have sometimes only maybe 15 to 16 candidates as opposed to almost 100 candidates in the UK exams. So then all questions which we have asked, the questions are the same. Examiners will ask the similar type of questions because it is all a set pattern. Most of the types of scenarios given will be similar. The diseases might be a little bit different because we are conducted in different countries. But all questions are reviewed in the light of performance of the candidates, of all the entire candidates of that cohort of examinations, and then the marking is modified accordingly. Thinking who is the best candidate, what is his performance, that is given some percentile score, and according to that, then the other candidates are also marked in the end. This is done by the college. This is not the examiners. Examiners who are taking your examiners at the time when the exam is being performed, have already judged you. Okay. So the cross compensation is possible in these examinations because oral examination has two parts. So structured viva and an OSCE station. Structured viva is only vivas where we are showing you certain things on the videos or some clinical scenarios, some clinical investigations. All those things are being shown again based on a clinical case vignette, and then you're asked questions on that. But your OSCE examination is totally clinical examination. You're examining that patient in life with the diseases. Okay. Now, what is this cross compensation? If you marginally fail the structured viva and you perform better in your OSCE, you can compensate your failure in structured viva, but usually not the other way around. So what is the structure of the exam? As I said, there are two components. One is a structured viva and second is the OSCE exam. These are conducted in 2 separate days, not on the same days. Now, again, we have started having hybrid format where in the structured and the OSCE exam, we have real patients. Along with that, we are again showing you certain recorded videos of the examinations of the patients, of the live examination of the patients. So structured vivas has 5 stations, each of 10 minutes. But on that day, when the structured viva is being conducted, we have 6 stations of 10 minutes each. The 6th station is actually a station of the OSCE part, which is being conducted on the same day because of the ease of conducting the exam on the same day as the structured viva day. So we have 6 stations on structured viva day, 5 structured viva stations, and 1 OSCE station being conducted because they're all 10 minutes each. 2 examiners are present at each station. In all the structured viva stations, there are 2 ophthalmologists. But at the communication stations, there are 2 examiners. One is an ophthalmologist, other is a lay examiner who is not an ophthalmologist. He is just observing how you communicate with the patient. So he's judging you in other ways rather than as an ophthalmologist. So he's not judging your ophthalmological skills, but your non-ophthalmological communication skills. So the structured viva has station 1, which is patient investigations and data interpretation. Station 2 is patient management. Station 3 is also patient management. There are 2 different clinical scenarios given here. Station 4 is attitude, ethics, and responsibilities. So this might be very confusing for the Indian candidates because we do not lay much stress on these things in Indian teaching. So these are attitudes, ethics, and responsibilities are again based on, as I said, certain things about how you communicate the management of the disease to the patient. What are the ethical responsibilities you have as a doctor towards your patients? What is the consent? How do you explain the consent for any procedure to the patient? So all this is included in this part of the station. And then the station 5 is the audit, research, and evidence-based parameters, where we talk all about whatever management you're applying. Is it evidence-based? How much research oriented you are? How much research you have done? What is the audit? Are you monitoring your own results, your own surgical parameters, your own surgical results? Are you monitoring them? Are you auditing them? That is what all this station includes. While the OSCE is a totally clinical exam, as I mentioned, where we have now started using a mixture of real patients and videos. Again, 2 examiners at each station. Station 6, as I've already mentioned, is a communication skill station, which is conducted on the previous day when the structured viva is being held. And the examination is in the form of short cases. Each station is for 20 minutes. And you're supposed to see at least 3 patients at each station within this 20 minutes. So again, the stations are listed as anterior segment, glaucoma inlet, posterior segment, strabismus and normit, and 5th is the neuro-ophthalmology. Communication skill is already mentioned earlier. So then this was the exam pathway to reach UK. Next is a fellowship pathway. For UK fellowship applications, even whether you have an FRCS or FRCO, both are highly respected if you're just directly applying for any subspecialty fellowships. Even without those, you can apply for fellowships if you are able to register yourself in the GMC, which is a General Medical Council registration of the UK. But if you have taken this, any of these exams, FRCS or FRCO, then it becomes easier in your applications for subspecialty fellowships. You are given more weightage. However, if you want to go to the consultant route, it would be best to take the FRCO exams. Then, as I said, the FRCO examination just gives you a fellowship of the Royal College. It doesn't. You have to register in the GMC in that. And then also, even after once you have registered in GMC, even there for becoming consultants, those who are trained in UK with the CCCE also need to take subspecialty fellowships before they can become consultants, because consultants are usually specialty consultants. So you will have to do a subspecialty fellowships even when you are based in UK and have done the entire residency pathway there. Okay. So for this pathway where you can directly go from India, after your residency, take this FRCO exam, do a subspecialty fellowship, makes it easier to get into the subspecialty fellowships, then enter into this GMC specialist register, and then this gives you an access to apply for NHS consultant jobs. So fellowship pathways, as I said, vacancies for these are available on various sites which I've given here, NHS, Track and NHS Scotland jobs. So this is, you can apply directly for these fellowships posts, or you can sometimes even apply directly to certain fellowship directors by directly going on to each and every college or every NHS firms or NHS listings there. Some of these trusts which can directly take you, like Moorfields, Manchester and Birmingham Midlands, which can directly take you if you apply to the fellowship directors, but you have to have an excellent CV for that. And third route is the ICO fellowship route, which Dr. Ashu asked. It is an easier route, but again, it gives you access only through an FRCS, not to FRC opt exemptions. Okay. So portfolio route is the second route, which I've already mentioned. Typically, Indian ophthalmologists, when they're going later in their life, prefer this route, because you take a fellowship FRC examinations and then you can apply for the NHS specialty doctor, do your fellowship, subspecialty fellowships there, and then you can apply in the GMC specialist register and become an NHS consultant through this route. This is suitable for experienced ophthalmologists, as I said, because you require not only a full 7-year UK training program, competency you have to demonstrate of your previous experiences. Okay, so it advantages, though you need not go to the 7-year of training of UK. It recognizes your prior overseas experience and it gives you a direct route once you have taken your FRCO examinations, and is being increasingly accepted, but you have to have an excellent CV. The challenges is it requires a very, very detailed portfolio of yours according to their 7-year training system. So you have to maintain your surgical records, your academic records, your research records of your entire previous experiences. You have a very well maintained portfolio. You will be able to apply to that directly. So documentation intensive is required for this purpose. The UK style, as I already mentioned, okay, which takes several years to assemble. FRCS of Glasgow is another prestigious examination which is awarded by the Royal College of Physicians and Surgeons of Glasgow. It is not a training pathway like FRC Opt, but it is a consultant level ophthalmology examination which judges your clinical knowledge and gives you an access for other places like UAE, like other countries of the Middle East, Singapore, and sometimes even for certain places for applying for fellowships in your New Zealand and Australia. Okay, so why consider FRC as Glasgow? It is an easier examination, if I would say, as compared to FRC Opt, but it is again internationally recognized, increasingly popular among international candidates who are looking at these other subcontinents, which I mentioned earlier. It also gives you a direct access to GMC registration, although a little bit difficult now. And it makes your CV strong for other overseas careers, which I mentioned. It is again has a 3 parts to it. Part 1 is the basic sciences. Part 2 is the clinical ophthalmology written examination, and part 3 is the structured oral and the clinical examination, similar to the oral examination of FRC Opt. Now, as I mentioned, the ICO, clearing the ICO standard examinations gives you exception for the part 1 and part 2 of this FMCS, not the part 3. So you become directly eligible for part 3 if you have already taken the ICO route. Part 1 is again 160 MCQs, 2 hours examinations with these components, assessing your basic sciences. Part 2 is assessing again a written examination of 180 MCQs of 2.5 hours, which is assessing your entire ophthalmology, clinical knowledge, including every system of ophthalmology. And besides this, it has an additional component of medical emergencies, acute medical emergencies, and ophthalmic, and you are supposed to know systemic medicine, especially ophthalmic neurology, and other systemic medicine, systemic diseases in relation, which have relevance to ophthalmology. So this is a difficult part of this examination. We are supposed to know other things which are not just ophthalmology, but beyond ophthalmology. Then they had the part 3 examination, which is totally clinical examination of FRCS Glasgow, which again has a structured oral exam, which is a viva, which is 3 stations of 20 minutes each. First station of LICS, oculoplasty and NDA segment, second on posterior segment and glaucoma, and third on neurology, motility. And again, this station is assessing your general medicine. And then you have the clinical examination, which have 4 stations of 12 minutes each. NDA segment, posterior segment, neuro-ophthalmology and ocular motility, and oculoplasty and lid. And again, here you have to at least examine 2 patients. If you do the third, you're able to complete the third patient examination. That is a bonus. So it is assessing your clinical reasoning, your image interpretation, your communications with the patient, your clinical decision making in these cases. So why is it attractive as compared to FRC Opt? As I said, it is easier. It gives you flexible delivery. Part 1 and part 2 are totally online. Part 3 is also being conducted at various international examination centers in India, in Delhi, Mumbai, and Bangalore, in Cairo, and in Oman. Additional advantages: you do not require any UK training, can be pursued while totally practicing in India. It again puts you in a strong international networking, examiner network, and it is useful for UK, as I said, although become a little bit difficult now, but for Middle East and other countries, Singapore and even Australia and New Zealand, it does give you better access if you have to go and apply for those fellowships and other trainings out there in these places. US pathway is the most difficult, I would say.
Vinita ma'am, I would like to summarize in a nutshell what you have told about the UK pathways. Okay. So FRCO, you said, is important if we want to pursue a fellowship in UK.
Not exactly. FRCS also gives you an edge. You can take that pathway which I told you is a CSRI route. But it becomes difficult nowadays because since 2012, now they have started the GMC registration as a specialist. If you have to register yourself in the GMC register as a specialist, you have to undergo any subspecialty training in UK. Now, for applying for a subspecialty training, if you are an FRCS or an FRC Opt, both are acceptable as per the norms. But most of the good places in UK where the subspecialty fellowships are happening, as I mentioned, Moorfields, as I mentioned, Birmingham, as I mentioned, Manchester, these are the 3 very good places for doing your subspecialty fellowships for most of the subspecialties. So here the people usually prefer FRC of candidates. Otherwise, if you're going at other places, they do take FRCS also as a qualification for applying for a subspecialty fellowship. And then once you have a subspecialty fellowship, you can register yourself in the GMC as a specialist so that you can then take the portfolio pathway, as I said, which is a separate route to directly apply as a consultant for consultant jobs in UK.
So, ma'am, you are saying that FRCO makes your CV more heavy. I mean, it helps in
Yes, yes,
giving you an
yes,
edge over the
yes,
others.
yes, yes.
Also, for FRCS, Glasgow and Edinburgh, they are mostly ornamental
Similar.
degrees. But if we want to pursue a career in Middle East or elsewhere, like Australia, New Zealand, then
Yeah.
they can help in strengthening our recommendations and also provides a benchmark of our knowledge.
Yes. So there are two things. Once for the other countries, like for the Middle East, let's talk about the Middle East. These examinations, once you have the degree of any of these colleges, whether it is FRCS Glasgow or Edinburgh or the Royal College of Ophthalmologists, it gives you an edge in attaining jobs there in Middle East. You get almost 2 to 3 times the salary if you apply as an Indian medical graduate based on your Indian degrees in Middle East. Vice versa, if you have these degrees as an addendum to your Indian degrees, then you will get almost twice to 2 to 3 times the salary as an Indian also once you're going to Middle East. So that is the biggest
So this
advantage of
is,
all these
yes, this is a
qualifications,
very
whether it is
important
Glasgow
point to
or
note.
Edinburgh or Royal College of Ophthalmologists.
It's a very important point to note that it can it can affect your salary in these
Salary, yeah.
countries.
And it gives you
Yes.
easy access. You are selected much faster. Because
Hmm.
now, in fact, in Dubai and your Abu Dhabi, they have two centers, I think, which are being run by Moofils. So Moofils Moofils College of London itself has opened its centers in Abu Dhabi and Dubai. In Abu Dhabi, I think, not in Dubai, and Abu Dhabi. So if you are a graduate, if you have these degrees, they directly take you in these centers. Otherwise, they usually do not take you as a consultant. So it gives an extra edge if you do have these degrees.
Okay, ma'am. Thank you for clearing this. Thank you, ma'am.
Okay, so I'll proceed further. So next is the US pathway. So US pathway for Indian residents is slightly difficult. You cannot take you cannot be on the US ophthalmology board examinations directly by your like the UK examinations you can take directly after your own trainings in ophthalmology in India. But for these, you cannot take the US ophthalmology board examinations. So you need USMLE, you need the ECFMG certification, then a match into US residency, the matching system which they have, then go into the residency route, and then you can take the US ophthalmology boards examination to practice as an ophthalmologist there. So it's a very long drawn process in US. Although some of the best residency programs are being run by the Wills, the Bascom Palmer, the Vimal Eye Institute, the Moshers Eye and Infirmary, we all know that actually. But the problem, as I mentioned, is there. But there is an alternative path, which is again not exactly like the residency path, which is a very long run path. You actually enter the residency system, which may not be possible for a person who has not thought about it, who is probably has already finished his ophthalmology residency in India for last 4-5 years and has been doing something else and is now planning to move to US. So he can apply for fellowships without repeating the residency there. These fellowships are usually either research fellowships, observerships, or limited clinical fellowships. If you actually have to practice on patients there, you will have to take USMLE and ECFMG. You cannot do without. But these research fellowships, some short-term observerships, and some limited clinical fellowships, some things which are clinical and genetics or clinical and some other investigative modalities fellowships are there, which allow you to take these fellowships without clearing USMLE. So some of these examples which I've given are some neuro-ophthalmology fellowships, some retina research fellowships, and ocular genetics fellowships. All those fellowships which require hands-on surgical on patients or any procedures to be done on the patients will require USMLE and ECFMG certification. Because that means you're practicing independently on the patient. So this path, which I said is without repeating your residency, is excellent if you're choosing an academic or a research-oriented career and you're trying to build up your publications or network. So the US pathway is highly competitive, costly, As I've already mentioned, the challenges, long duration, requires a repeat residency, but offers excellent clinical exposures, excellent research opportunities. There's no other country, I would say, except for the MUFIs, which does a lot of basic and genetic research. The best basic sciences research, especially if you want to do genetics research. And as we already know, the first gene therapy, every research is coming from US in ophthalmology also. So the best research opportunities are in US as of now, in across the world. And you have high earning potentials in these research jobs also. So please remember, if you're not wanting to do repeat residencies, I know of lots of people who have moved from LVPI after several years of consultees, and they are now have taken research opportunities there and now working as consultants there, but again as research consultants there. Okay, and earning excellent, enormous amounts of with very, very high earning potentials they have at this present stage. I can name few of them if you know. Jay Chaplani is one, Raja Narayanan is one. So they have all gone. Raja has the other route also because Raja cleared his MLEs, but Jay Chaplani did not take the MLE route. He has gone through the research route and now he's practicing doing retinal research as a retina specialist who's doing lots of research there and is associated with with school. I'm forgetting the name of the school, but he's doing excellent retina research there. He's not practicing on patients, but he's doing research in retina and earning enormously there. So fellowships in USA, there are various long-term and short-term fellowships which are offered by US in basic sciences, clinical plus research, and collaborative fellowships. Best time to opt for these US fellowships would be after completing a long-term fellowship in India, because again, they have very, very high standards. So you have to have some basic knowledge in whatever you are applying as a first-time fellowship for this. They have a superior quality of training, as I mentioned, for all their fellowships. This gives you a wider perspective once you do these fellowships. In certain places in California and Pennsylvania, as I mentioned, overseas candidates may be exempt for certain clinical fellowships, which are not exactly purely clinical fellowships, but a combination of clinical and research. So then next is the Canada pathway. Canada, if your goal is fellowship, Canada is very, very easily accessible. You do your residency here, do good publications, get some good references, apply directly to their fellowship programs, and you get a Canadian fellowship. No qualification examination of the medical Canadian college is required for this. But if the goal is permanent practice in Canada, again, it is considerably harder, similar to US. You will have to clear their medical Canadian college qualification examinations will have to be taken. And then again, accreditation qualification is also required, certification is also required after that. Then a matching is required of the Canadian register. Then a 5-year ophthalmology residency is required before you can take the Royal College of Physicians and Surgeons exam, and then you become eligible to practice in India. So this route is again similar to the US route, permanently migrate as a consultant in Canada. Fellowship is again very friendly, as I mentioned, give you very good pay, reasonable patient volume. And again, if you're an FRCS applicant, again, if you're cleared FRCS, you again get a priority consideration for applying for fellowships in Canada also. As I mentioned, I missed this part. So for Canada also get an added advantage, not only for your Australia and New Zealand, but also for Canada. So direct applications are also accepted in some cases, but FRCS and FRC off gives you an added leverage. And then here the practice ready assessment route is there, which is for certain internationally trained physicians in selected specialties, is there for direct application as a consultant in Canada. But for ophthalmology, this route has yet not opened. This is a new opening which has started for certain in-need specialties which are shortage in Canada. Then the European pathway is not to be, I'm not talking too much about this pathway because it is again similar to the UK board. It is a European board examination which has a written paper and a clinical component like for all the FRCS examinations. It is widely accepted across all the other European countries. Then we have the Asia Pacific routes for the Singapore and the Hong Kong. places. We had the Asia Pacific Academy of Ophthalmology, or the APO fellowships. Recently, we had the APO conference, I think just last week. And maybe there people who have gone there may have heard about it there. So these places also offer structured fellowship opportunities for candidates from India. We have the SNAC, which is a very well-known place which offers a lot of fellowship opportunities. And we also have the Tan Tong Singh Hospital, which usually give 1 year and 2 year fellowships, which are funded, which are not actually, you get paid during these fellowships. And similarly, we have the National Universities Hospital Fellowships, which have fellowships which are again funded. And people who are FRCS or PhD, they get priority here as well. So, and in this, the added advantage is once you continue with these fellowships, you may get a conditional registration to practice there after completion of these fellowships based on the recommendations of your institute where you're conducted your taken your subspecialty fellowships. Hong Kong also offers 4 oculoplasty fellowships every 2 years, which are of 1 or 2 years duration, but these are non-funded. So that is the disadvantage here. You will have to bear your own expenses when you're staying there, and you will not be getting any pay as well. So next is the Australia and the New Zealand pathway. So we have the Brisbane, Sydney, Adelaide, Melbourne, and Auckland. These are the states of Australia and the New Zealand, which are offering you fellowships, which are under the RANSCO, the Royal Australian and New Zealand College of Ophthalmologists, which are again well-funded with good exposures, especially for oculoplasty and oncology. Have lots of fellowships there. You can either apply directly to these colleges, to these places, or you can apply through the Royal College of Royal Australian and New Zealand College of Ophthalmologists by taking their exam, which is again like an FRCS exam, where main thing is, but if you have taken the FRCS exam, they may still accept, they will also accept, but you will have to clear a separate IELTS or the OAT certification, which is for English language. So they will, either you take the exam of this Royal College, or if you have taken FRCS or FRC of the examination, we can still apply for the fellowships, but you will have to separately take an IELTS or an OAT certification from their Royal College, which is an English testing exam, very easy exam, not at all exam. Testing your English speaking and writing power. So fellowship in other these countries, why consider this Australia and New Zealand? It has again very high quality of training, excellent work-life balance. It's a very cool country, very good work-life balance, not too much populated like UK now. Strong, very good surgical exposure you get, very good research opportunities also you get. And the pathway requirements for the RANSCO pathway, as I said, medical registration, either you register directly by taking their exams. You can go as a trainee. Also, you can take their entire system, or you can take their college exams of the other colleges and register into their thing by taking their English language examinations. So again, all these pathways are very competitive pathways. Then we have the Dubai and the Middle East. As I've already discussed with when Dr. Ashu asked me the question. So just you will need to take the basic sort of a registration exam, which is a Dubai authority exam for Dubai, and similarly for the UAE. But if you already have these degrees, FRCS of Glasgow or Edinburgh, or FRC of Royal College of London, you get an edge, which I've already explained, not only of getting the job faster and easier, but also getting almost double to triple salary. Also, if you have fellowships of the ICO, there's a very lot of fellowships of ICOs which are sponsored by ICO are also available there in these Middle East countries, which are 3 months, as I said, are available there. While some of the fellowships which are offered by these Middle East countries are funded by their own hospitals. Other countries in Middle East which are offering you these jobs, the same job opportunity, but do not have the fellowships are Saudi Arabia, Qatar, and Oman. The route, if you want to go to Dubai and the Middle East and the other countries of the Middle East, as I said, after your ophthalmology training in India, you can just take their license exam. As I said, for the different countries, we have DHA, DOH, MOHAP for different countries. As I said, DHA is for the UAE, DOH is for your Saudi, Okay, so you can take these exams and then you can directly apply as a special ophthalmology specialist there for your job. But if you want to apply for a consultant job, it is best you do a fellowship either through the ICO route, a long-term fellowship of 1 year, or you take the FRCS and FRCO of the exams, and then you can directly apply for a consultant license there. Licensee, consultant licensee exam can be directly taken, which is again to practice as a consultant there as a senior consultant. Where, as I said, once you apply as a senior consultant, your job, your salary is almost 2 to 3 times as opposed to when you're applying like a specialist ophthalmologist. So I think I've covered almost all the exams. Anybody who has any questions amongst like the worldwide overview I've given you of most of the exams of all the major countries, major continents across the world. So this is, I will just talk about when you're now, what should you, with the way you should be preparing and when should you be ready? How should you plan? So if you have any questions before that, we can take a short question and answer session here.
So I request the hot seat residents for today, Dr. Dimple Nehra, who is JR3, and Dr. Sunil Chaudhary, who is JR2. Dr. Dimple and Dr. Sunil, you have any questions? You can switch on your videos also. Dr. Dimple?
Good evening,
Dr.
ma'am.
Sunil?
Uh,
Good
Good evening,
evening,
ma'am.
Dr. Sunil.
Ma'am, my question is was where any second year resident, yeah, any third year resident plan for any foreign national exams? When and how should he plan for these international
This is
exams?
what I'll be covering in our next section. So ready to take the plunge? So let me then complete my talk. I thought maybe you had a different question. So okay, let me continue. So once you're ready to take the plunge, you have to plan very well. You have to take all your support from everybody, whether it is your family, whether you're working in a hospital, whether you're actually already working as a senior resident, whether you're doing your residency or you're already in the, as you, Dr. Sunil asked, whether he's already in the first or second year residency. So you have to start first plan it out. When do you want to take it? You will have to chart a timeline according to the number of which examination you're looking at. Start early. ICO, as I said, is an asset. First examination, you should always target, if you are doing your residency at that time, is either an ICO route, or if you're planning a UK route, any of the FRCS or the FRCS part 1, part 2. So you can start taking any of them at the beginning. Okay, either the ICO, which gives you exemption of the part 1 and part 2 of the FRCS, or you can directly take the part 1. If you do not want to take the ICO route, you can take the part 1 or the part 2 directly of the FRCS, or even the part 1 of FRCO. As I said, because no training in ophthalmology is required for taking these part 1 examinations of this. Always, besides the family and your colleagues and the peers as a support, always take the support of some mentors. So please take a mentor who has already taken any of these examinations. Make him your mentor once you've decided that you're taking the plunge. Also, at the same time, build your CV. Keep on doing research, keep on doing publications, keep on doing presentations. Because as I said, later on, when you have to apply for fellowships, even after taking the examinations, you have to have a strong CV. So best time to apply for these examinations is start early. So you can start the first step when you are in your residency. As you finish your residency, go to the next step. That is a clinical part. You can start once you finish your residency, or once you're doing your any subspecialty exposure. So common myths are there that these jobs will guarantee you, these examinations will guarantee UK jobs, which I've already discussed, or USMLE will guarantee you residency. It is not like that. International, these exams are only for only there once you have completed there to give you access for migration by going into some fellowships there, which allow you to take their registration, board registrations, or register into the specialist registers, so that then you can apply as a consultant. So, and you do not have to be very rich. Yes, I would say these exams are not very cheap, but you don't have to be extensively rich to pursue them. So the real benefits beyond migration, even if you do not want to migrate to a different country outside your country, what I gained and what I still say taking any of these examinations gives you tremendous knowledge, a very, very structured learning, which is missing in quite a lot of places in India. In Delhi and major cities, I would still say there's a lot of structured learning happening. In good medical colleges, a lot of structured learning is happening, but in certain remote medical colleges I've seen, the lack of structure is there in India. Besides this, as I've already mentioned, gives you very, very good networking with all the people across the world, and lots of research opportunities are opened up. So as a resident, as now we come to your question, you can either take the FICO, the FRCO of part 1 or the FRCS part 1. As a junior consultant, you can take the full FRCO one after the other in consecutive, not waiting for just as soon as the exam comes, you take the second step, the third step. As soon as the exam result comes for the second step, you take the third step. Or you can do the ICO advanced. So basically, as it depends at what stage you are. If you're the residency, you can do the ICO, the standard examinations of the FRCO of part 1 and the part 1 of FRCS. If you're a consultant, take the full exam one after the other, or the ICO advanced examinations. So this is a suggested roadmap. In year 1, build your basics, do some of research as well. Year 2, start taking the ICO basic sciences, ICO clinical sciences by year 3, or the FRCO part 1 and ICO advanced by year 3. As a consultant with a subspecialty focus, start taking your FRCO of the clinical exams, start applying for international fellowships, do lots of publications because this will add on to when you're applying for your international fellowships. So this is the suggested roadmap, which I will say if you want to migrate as a consultant, or if you want to add on to your network, your academic and your research portfolio. This is just a comparative table. All these examinations, ICO, FRCO, MLE, you can take from India. Right now, the written parts, components part, the clinical parts for ICO, FRCO, MLE, you can take for ICO and FRCO, you can. For MLE, except for the match, you will have to go there. Rest, all that can be done. But as I said, ICO is the easiest, can be done within months. FRCO and MLE usually require between 2 to 5, the RANSCO usually require between 2 to 5 years, but the USMLE is the toughest, requiring the longest period of duration because you need to undergo the entire residency. But in the meantime, as I said, whichever pathway you want to choose, whichever country you're looking at, the key components is to build a very, very strong CV with publications, presentations, taking these examinations, building up a very, very strong research portfolio, taking fellowships, subspecialty fellowships. In the end, I would just say start early, build a strong CV. Research is very important. Exams are just stepping stones for building a strong CV and for opening up your international opportunities. Your career is not limited by your geography, but limited by your own vision, your own outlook. So these are the questions. If you have any questions before that, I'll take those questions before I ask the questions for which are to be given as awards.
Hello, good evening, ma'am.
Yes,
Hello?
Dimple, you can ask a question. Yeah.
Myself, Dr. Dimple. Sir, I just want to ask what opportunities exist abroad for ophthalmology who are more interested in academics and research than clinical practice?
So as I mentioned, Dimple, if you're more in research and especially research, and which is clinical research, or whether it is more of basic research also in the field of ophthalmology, the two best places are Moorfields Eye Hospital in UK, and I would say the Wills, the Bascom Palmer, and the Harvard University in US. So obviously, as I said, especially if you want to do totally remain later on in your life, also you want to pursue more of a research career, and you don't want to be associated directly into clinical career, as in directly dealing with the patients at all times. You do not want a surgical care. So then these are the best opportunities. But if you want a clinical career, then obviously I would say you will have to take a complete residency program, whether for UK, the FRCO route, or the route which I told you, the pyramid route, which was there, is possible. For US, it is not possible. For Singapore, it is possible because limited fellowships can give you sometimes completion and registration as total completion clinical consultants there in certain fellowships. For Singapore, it is possible. For Hong Kong, it is possible. For UAE, it is, as I said, is already possible. But for US and for mainly for Australia, you will, if you want to do clinical fellowships, you want to do surgical fellowships, you can do their fellowships. But for that, and to practice as a consultant later on as a surgical fellow, you will have to take their own residency programs and clear their board examinations, which is a long drawn route of 4 to 8 years.
Okay, thank you, ma'am.
So this is one question, first question. I think I'll read it out, although it is visible on the screen. So maybe any of the person who's sitting on the hot seat can answer this. A final year ophthalmology resident in India wants an internationally recognized examination that can be attended during residency and is accepted worldwide. Which would be the most appropriate first step? Sorry.
You can type your answers into the chat box. I think, Vinita, you have taken a whole tour of the world around. So people
Sorry,
are
I
still
think I
thinking
went
which
to the
part of
last
the
slide.
world they should go to.
No,
Please
that's
write
what
your answers in the chat
probably gone
box.
over the slideshow. I'll just.
No, it was a well-crafted presentation, and I think it gave a lot of insights into what to think about if people are thinking about to add to their CVs or even planning to go abroad. I think that's a very good presentation and a great, kind of
Ankur, I'm not supposed to answer this. No, the answers would be.
no, they would be answering, but now you can answer because I think people are either very
I've already
confused
because
or
I've not seen that. I've not seen
yeah,
that
there's
because
nothing is coming in the chat box. It's okay, you can answer, Dr. Vinita.
okay.
Yeah, this is
So
the first one
the
comes
first
from
appropriate stage for a final year ophthalmology resident, as I said, I gave the roadmap would be to take the ICO, which is
Yeah.
easiest, and also it is less taxing on your as a resident on your pocket as well. So the most appropriate
Dimple
first step
has
would be
put the
taking
answer. I think
ICO.
register for the ICO. That's the correct answer, I
Yeah,
guess.
yeah.
So we can move on to the next question.
Yeah. The second question is, if you could choose only one international examination to maximize your opportunities for fellowships, employment, and career progression in the UK, which would it be?
So this comes from Gagandeep Kaur. It is FRC Ophtha. Is it correct?
Yeah, so that's
Yes,
correct.
correct.
So as I said, because FRCO gives you opportunities not only for taking fellowships, but also for getting employed by getting registered into their specialty register. And once you get registered as a specialist in their UK GMC, you can apply for consultancy job in UK. So that's right.
So both
Excellent
of-
presentation, Vinita ma'am. So not only students and residents, we were also enlightened by your talk, and we came to know what opportunities are available even as a consultant for us in the different countries. So you comprehensively covered all the countries, and as sir said, you took us around the world. So thank you so much.
This is just in the end, I'll just put this slide. It's not elaborating a slide. We have, as I said, I'm already conducting mock courses just before the exams, which have been conducted in India for these both the colleges, FRCS class, the Royal College of Glasgow, as well as the Royal College of London. So we have the next session, the mock exams. Whoever is in any way interested in taking these exams and these mock courses is open to apply for these courses.
Dr. Vinita, can you just put on your slide for the specialist pathway for Australia? This is Dr. Gagandeep. She wants to have a look at it.
Okay.
So that will probably help her think about what she wants to plan for Australia. And I think there's a message from Dr. Preeti that's a very insightful, informative session. I think it has been actually. So this is what Dr. Gagandeep we have. I think Dr. Vinita can explain it again to you.
Yeah, so basically, these are the basic states which I mentioned where you can apply in Australia and New Zealand. And these are good fellowships, but most of the fellowships which are right now open are mostly for oculoplasty and oncology. There are lots of seats in those. In cornea and refractive and even in retina, there are a lot of competition for those subspecialties. You can apply directly as well after your Indian degrees. If you have taken your FRCS or FRC of examinations, or even the ICO routes, ICO, the clinical, if you have the FICO, it gives you slightly added advantage. Or if you're applying directly without these degrees, or you can directly write to the Royal College. You can directly apply to these states and these multiple places of the fellowship who have opened up the fellowships by directly applying to the hospitals. However, you can directly apply to the college also, the Royal Australian New Zealand College of Ophthalmologists, by taking their exam. But before you do this, all these fellowships ask that you will have to clear the IELTS, which is the English speaking language examination, or the OAT, either of the two. So
Ma'am, in one of your slides, you said that the examination for Australia and New Zealand that can take several years.
No. If you
and
have
is
to
one of
enter
the
as a
toughest.
consult, no. So what I'm saying, this is for the fellowships. And
Not
to
for
enter the
practicing there.
No, for practicing the RANSCO pathway is required, which is again a very competitive, very tough pathway.
Yes.
Which requires your training. You have to undergo as a training. You can apply, but it is again a very tough pathway. They usually do not take you.
Absolutely.
I think that's first. The tougher part is for settling down in Australia.
Settling down as a consultant. If you want to settle down as a registrar, as a fellow, for short-term training, you can do one fellowship, you can do another fellowship. But to settle down as a consultant, you will have to go into the training systems unless until your CV has become very strong. As I gave you 2 examples of US people, there are people who move to New Zealand also. You know, everybody knows Vajpayee sir. Vajpayee sir moved there as a consultant. So you have to have a very strong CV for that.
So I think with this, we come to an end of this nice session. Thank you.
So, and the end that says is stay positive, work hard, you can make it happen.
Yeah, that's true. That's true.
Wherever you have the hope, there is always a light guiding you. You will always move ahead only.
Yeah.
Absolutely, ma'am.
Yeah.
Thank you.
Thank you, Dr. Vinita, and thank you, Dr. Ashu, for moderating it and steering it in between where things were getting a little confusing. I could see that, you were there to help out the kids to understand what it actually means. So thank you, both of you, and thank you, everyone who attended this session. I think it was a very informative and a great session. Thank you once again.
Thank you. Thank you. Thank you, Ankur. Thank you, Rajasthan Ophthalmological Society, for taking me on board. Thank you.